Thanks so much for taking time out and just going by the fact that this is something that the company has been looking at for the past many years in terms of this new foray. How are you looking at this backward integration with hospitals as to what it could potentially mean?
That plan is the media broke the story, the company is not denied it. Yashish has spoken about it in the previous con calls as well. So it seems like they want to do this. Now, how they go about doing this is the question. Is it going to be capital intensive or it'll be a partnership of sorts? It seems like that is the big question that's weighing on the stock because people bought into the story for PB Fintech for its strong growth, its capital light business model. I think investor communication on that front would be helpful in cooling off speculation. And I think the stock is now stabilized, but the last 3 days has been very, very volatile. So I think clarity on that front will be helpful. We've written a note today which talks about the key questions for the management. Essentially, what is the business plan? It is good for the consumer and probably good for hospitals and insurers, and therefore good for Policy Bazaar. But then, at what cost does all of this come up? That is the key question at this point in time in my mind.
Yes, I'm sure. And while, of course, there is no real clarity, give us a sense as to how you believe this is going to really work out, or what do you think should be the ideal way it should play out? They've spoken about it being less capital intensive, which is something that you guys have flagged off in the note as well. So, do you think they'll be looking to build their own hospitals? Will there be partnerships with existing hospitals? And more importantly, what would be the more lucrative method that they should adopt?
That's exactly the questions that we also have. Now, one way to approach capital light would be do partnerships with existing hospitals. The other way to do capital light would be partner with investors, and then you go and acquire or build hospitals, whatever. So, option A versus option B, that is the key question. I think the other question to really answer is essentially who is going to spend time from the management team on the hospital business. How does that impact management bandwidth on the insurance distribution piece? That is one example, the one question I'm getting from investors. The other thing is, does this mean that Policy Bazaar in its current form becomes a capital intensive business going ahead? Or is it going to remain capital light, and what that means for free cash flow generation? So many questions, few answers. But I think investors would be happier if it was less capital intensive than more capital intensive. And I think investors would be happier if there was more clarity around all these questions.
Of course, there are so many and that need answers, but I just want to understand what this would mean in terms of how it could really help health insurers along the way. So, how beneficial, according to you, of course, once we have more clarity as to how it's going to work, as to how beneficial it is going to be for consumers?
Sure. So it looks like Yashish has a view, and I think I see what he's trying to get at. That the problem right now is hospitals look at the bed inventory as a driver of revenue, and therefore pricing per bed is high. And for their business model, it makes sense. But what it means is consumers end up paying more, insurers end up paying more than probably they should have to, or at least what makes the affordability better for the consumer and for the insurer. So if consumers are able to get access to treatment at lower costs and better claim experiences, that's good for the consumer. If it does entail lower cost, it means lower claims for medical insurers. So that's better for insurers as well. And then if Policy Bazaar can drive better claims experiences for insurers, they could probably build a business model around that with juiced up commissions on these insurance distribution business side. So that's what it looks like. Yeah.
Have there been any such backward integration cases globally? Do you think that we can expect the same from PB Fintech? How has that really worked out?
Sure, not many precedents to go by. We are also actively looking for precedents, but we've seen cases in the US or in Australia for that matter, where insurers have worked with hospitals or healthcare indirectly or directly. There are some examples in the US where a healthcare player became an insurance player eventually. but very difficult, at least at this point in time, to point out examples where an insurance distributor has gone back and backward integrated with the hospital piece or the healthcare piece to drive a better customer outcome. In India, insurers are not at that scale on the medical insurance side, or they don't have the intent at least to do that. Regulatory capital requirements are also constrained, so probably Yashish takes up the mantle and does that.
Sure. And when it comes to financials, I wanted to understand your take as to how this could potentially help boost the profitability, boost the margins at the cost of giving up an asset light model if they do decide to go investment heavy.
Sure. So the first thing that will happen is the cash on the balance sheet, which contributes meaningfully through interest income to the bottom line, that will get deployed, and your interest income should contract at least in the near term. Uh, if and when this gets deployed, if it gets deployed properly, it may generate return on capital in the long run. But near term, your profitability, your cash flow generation will take a backseat, and that's what's weighing on the stock, to be honest.
There comes a time when your heart calls for you to arise. Plant your feet solid into the ground. Decide your own limits. And then break right through them. Become something more. It's my time to rise.